Hello, this is a third part in the video series discussing how occupational therapy and occupational therapists can assist religious organizations and churches. If you haven't watched the two previous videos, I highly recommend you go watch those so that you can be up to date on the content of this video. The last two things I want to talk about, actually there's three. There's the last three things I want to talk about are two more reasons how occupational therapy can be effective in religious organizations and where funding would come from, whether it be covered by insurance or not. The first thing, and this is a small thing but I think very important, is occupational therapists are trained in minor first aid. They are trained, they're not medical professionals to perform like doctors are, but they are trained in small things like CPR that they could perform during meetings and church gatherings to look out for the well-being and health of the members of the church. And lastly, occupational therapists are trained to help someone explore their spirituality. Oftentimes, spirituality is a big part of somebody's journey after recovering from injury, such as a stroke. That would be a very difficult time in somebody's life, and a lot of times they reach out spiritually to receive some sort of recovery. So occupational therapists are trained to help people branch out and explore their spirituality. And I think a lot of times in religious settings, spirituality and religion are separated. An occupational therapist could help bridge the gap between spirituality and religion and help people understand that they can receive spirituality in many ways, and it doesn't always have to be within the confines of a chapel. I myself am very religious and find my spirituality having growth within a church, but I also can find it in other places. And an occupational therapist could help where maybe a member of the clergy could not. Help someone understand that they can receive spiritual uplifting outside in nature or with friends or with family, and doesn't always have to be within a church setting. And I've kind of talked about this in little points throughout this video series, but reaching out to an occupational therapist as opposed to a member of the clergy, the big difference is that an occupational therapist is licensed in many different aspects. Licensed in mental health to treat mental health, licensed to help people overcome barriers and obstacles in their life. And they've gone to schooling and they've worked hard to receive the degree that they have. Where a member of a clergy might not have that same experience. So relying on an occupational therapist or using an occupational therapist to have that little extra knowledge of how to help an individual. And lastly, as far as funding or where money would come from for an occupational therapist if they wanted to work in this aspect, I believe it would come from within the church organization. Especially because if the church organization wants to hire an occupational therapist that is also part of their faith, they could have both of those aspects coming in, or both knowledge from both of those areas to help assist an individual. So it could come from the church within. The church could hire occupational therapists to assist their members in the challenges that I've listed. That's it for the series. If anyone has any questions, please leave them down in the comments. I'd love to talk with you further, and I'll see you later. Thanks for watching.